Hello, my name is Ashley Deadweiler Jones, and I'm here with my co-host, Miss Andrea Evans, and we are here highlighting HBCU's excellence. HBCU Highlights is all and every way excited about talking about those who are doing great things in the community and in their career. Today, we have Dr. Bolden.
Hi.
How you doing?
I'm great. How are you guys doing?
We're doing great. And Dr. Bolden isn't just Dr. Bolden, but she is my Spelman sister. And Dr. Bolden, we want to know about your journey to Spelman. What took you and what led your steps to Spelman College?
Oh gosh. So I am actually a legacy Spelmanite. My mom went to Spelman, and so I knew about Spelman pretty much from the day I was born. I got to meet all my mom's Spelman sisters, her roommates, her very best friends that have been her very best friends for life. So I always knew that Spelman was an amazing place. Ironically, I think my mom may have taken me to Spelman once when I was pretty young. But aside from that, in my teenage years or my formative years, I never set foot on Spelman's campus, never. I knew the campus from a different world, and fell in love with it in that manner. And then just talking to my mom and being around my mom and all of her friends, I knew that it was definitely a place that I wanted to go. So when I applied to college, I applied to 3 institutions. I applied to Spelman, Hampton, and NYU. Don't laugh, but I was applied to NYU because that's where Theo went on the Cosby Show. So that was kind of how I went about applying to college. But Spelman was definitely at the top of my list. And then I was extraordinarily fortunate to be the recipient, along with your co-host, Andrea, to be the recipient of a scholarship called Women in Science and Engineering, or I'm a Y Scholar. And that was almost like an unbelievable gift because it was everything that I was looking for all in one package. So it literally was something that kind of took my breath away. But at the time that I got that acceptance, I knew, okay, well, can't get much more perfect than this. Spelman College, Women in Science and Engineering Scholar. And so without having set a single foot on Spelman's campus, my first day on campus was when we showed up for summer science. And it was like walking through the gate and getting on that campus and being surrounded by other young Black women who were, wet behind the ears and aspiring to do great things. We were all kind of on this level playing field. And it was the perfect environment, and hands down the best decision I've ever made.
Well, Kelly, I'm so glad that you chose Spelman because we were roommates. And so we had a lot of good times in college, having a lot of fun, working hard and playing hard. But I want to take you back to 1994. Like you said, we both had that Y scholarship, and we were part of the summer science and engineering program. And so right after we graduated from high school, a few weeks later, maybe a day later, we started college, basically.
Right.
So I want to know what influenced you to study engineering and science in the first place.
So I grew up, it's funny, Andrea and I both grew up in Houston, Texas. People used to always tease us because our accents are completely and totally different, but we literally grew up in the same city, just different sides of town. But I grew up on the south side of Houston, pretty much, and if you all are familiar with Houston, pretty much right between downtown Houston and Galveston, in a place called Clear Lake City. It actually happens to be where Johnson Space Center is located. So my family, my dad has worked for the space program for years. All of my neighbors work for the space program in some capacity, whether they were actually in the space program, engineers for the space program, contractors, you name it. And I had the pleasure of meeting Mae Jemison at a very young age. Mae Jemison, first Black female astronaut in space, and Mae Jemison was an engineer, and she also was a physician, and then she became an astronaut. And when I tell you, this woman when she walks in a room, she just takes over without even saying a word. And she's been like that since I can remember. And so having the opportunity to not only meet her, but actually be able to spend time with her and, consider her someone like family, that was really what spurred my interest in doing engineering, or at least at a minimum doing science and engineering. So really, it just everything just fell into place. It was one of those things where, I'd love to say that I had everything mapped out. I know a lot of kids have like these aspirations, what they want to do. I kind of knew that I maybe was interested in medicine, but I wasn't sure. I knew I liked science. I knew I liked math. And so I just would take opportunities when they were offered. So if someone said, you know, hey, here's an opportunity to do a summer program in California at JPL, which is exactly what happened. I said, sure, I'll do it. And I went out there for this summer program. They actually thought I was a college, they thought I had finished my freshman year of college, so that I was a summer internship for college students. And I was actually going into my senior year in high school. So they'd made a mistake, but I was already out at JPL in California. And so I had this amazing experience. I got to work directly with engineers, which I'd never done before. And so when, you know, the cycle came around and the WISE opportunity presented itself, engineering just seemed like an easy option, because I knew from having met several other college students, seeing different people in the capacity that engineers worked, I knew that I didn't have to do engineering in the sense of like, you know, whatever, protractors and all that kind of stuff. I knew that engineering would allow me to really have the depth that I wanted to really pursue whatever career I wanted to do. So that's how I got to the WISE scholarship. And then with the WISE scholarship, I knew, okay, if I want to do biology, I can do biology, which actually wasn't true. I couldn't do biology. But I knew that there was going to be a pathway for me. And getting to summer science and meeting all of these other people that had similar ambitions was pretty daunting at first, to be honest, because where I went to school, it was majority of white high school. I think we had 3% Black students. So just setting foot on Spelman's campus alone was like this utopia for me. I'd never seen anything like it in my life other than, you know, community organizations that my mom and dad had us in. So that in and of itself was amazing. But then to see all these other Black kids who were extraordinarily smart, super motivated, super fun, easygoing, like it was kind of like seeing other versions of myself everywhere, having come from a place where literally it was me and maybe like 3 of my best girlfriends, and that was all I had exposure to. And now I guess summer science, we had maybe 40 people in the program. So that was pretty amazing. It was challenging educationally, but it was so much fun. It was great. We did trips. I think we took a trip to Florida. It was just amazing. I don't even know how to describe it. It was such a great experience and a great introduction to college.
Awesome. It sounds like you had a lot of fun.
We had a lot of fun.
Well, I wish we hung out a little bit more in school. It does sound like you had a great foundation for math in every sense of the word. So you could have gone in any direction. But when was that aha moment that you knew you wanted to go into medicine? And was there someone that kind of mentored you along the way that helped you get to where you are today?
So I developed the interest. I know I developed an interest when I was younger. My mom made me. I didn't want to do it. And if there are younger people watching, you probably don't even know what this is. But my mom actually made me volunteer as a candy striper one summer. And so we had a local hospital. I actually had the little uniform, and if you guys remember, it was like a little uniform with red stripes and had the little hat and the shoes. And so I did that. And I actually enjoyed being in the hospital. Most people, that's probably a real thing to say, but I enjoyed being in the hospital. I enjoyed kind of being around patients. I enjoyed working with the nurses. So medicine was at least on my radar, but still not anything that I committed to. Again, interacting with Mae Jemison definitely put that bug a little bit further in my ear to be like, okay, this is pretty cool. But really, when I was in undergrad, I knew that medicine was probably an interest, but I still wasn't fully committed. Being in Atlanta, great hospital systems. And so I had the opportunity to volunteer at Grady Memorial Hospital. And that probably was when I knew, okay, this is definitely the field that I want to be in, just by being at Grady. At Grady, you see a little bit of everything. So I got really great exposure. I met a lot of other physicians who were able to mentor me. Unfortunately, still not a lot of Black physicians, and definitely not a lot of Black female physicians. So I did have to kind of rest back on what was familiar and people from home, but ultimately had excellent mentorship in the WISE program. We had wonderful teaching assistants, but we had the most amazing mentor also, Etta Faulkner, who, interestingly, she tried to talk me out of medicine for the longest time, because the WISE program really was trying to promote women in science and engineering, but really more like PhD type of thing. So she always had a handful of girls in the program that wanted to do medicine, and she sort of obliged us. But when she realized that I was really committed to it, she became also probably one of my biggest advocates and made sure that I had the resources that I needed to succeed, made sure that I was able to foster relationships that I needed outside of Spelman. I had great professors, and so that all really helped. And then, of course, being dual degree and getting to Georgia Tech, that opened up my mentor, I guess, space even more. And so I was able to meet a few more people in that respect. And it really was what enabled me to get a strong footing on basically applying to medical school and all those kind of things. But I'll be honest, even when I was applying for medical school, I was also interviewing for engineering jobs because everybody told me it was impossible to get into medical school. I wasn't pre-med at the time. I was a chemistry major. I did chemistry and chemical engineering, but I wasn't pre-med. And so everybody kept saying, oh, you'll never get into med school. You're not pre-med. So I actually applied to medical school. I applied to jobs in the engineering space. And then I would coordinate my med school interviews with the jobs so that they would fly me out there and I could stay in the hotel, then go to the interviews, and was able to kind of save some money in that respect too. But still not fully committed until I finally got accepted to medical school. And at that point I was like, okay, I can do this. And, this is what I want to do. I can do this. It's, it's still daunting, but I can do this. And that was really what set me on the path, was just that acceptance to medical school and having some options as far as where I wanted to go.
Hey, well, you did it, Kelly. You are Dr. Kelly Bolden. And we're so proud of you. And I have a good, vivid memory of us working at NASA and setting up our Hotmail email addresses. And I don't know if you remember this. This is when email was very new. We were excited about having email to keep in touch with our friends. And Kelly said, I'm going to make my username Dr. Kelly Bolden because I'm going to be a doctor. And I remember that like it was yesterday. So you have earned that doctor, and kudos to you. Let's go back, because you light up, Kelly, when you talk about Spelman and the fun that we had. What was your favorite memory? It's so many good times that we had in the entire AUC. So we took advantage of classes all across campuses, from Clark to Morehouse to Spelman, you name it. But outside of the academics, or maybe it was something that happened to you in a class, what's your favorite memory while you were at Spelman?
Oh gosh, that's such a tough question to single out one memory. Let me think here. Okay, so I guess one that popped in my head just now when you just mentioned that, and I don't even know, I think they call it Spirit Week now, but it was freshman week. And all of the dorms had step teams, and we had a whole step show and the whole nine. And so Andrea and I were roommates in LLC 1, or Living Learning Center 1, which was considered the nerd dorm.
No, it was the dorm with the air conditioning.
Well, I was going to say it was considered the nerd dorm, but it was also the dorm with air conditioning. So we were kind of like, okay, fine, we'll be the nerd dorm. But we had a group of women that got together. I was on the step team, and we were ninjas. And we actually had like these ninja outfits and the whole nine. And I just remember that it was so, and what was, the gym's not even there anymore, I don't think, because they've done the whole new center, but it was in the original gym that was there, and everybody came, it was like the entire freshman class from Morehouse and Spelman, and probably even Clark, honestly, I wouldn't even doubt it. And it was such a great show. We won, by the way. But that's probably I think that's probably the most vivid memory from freshman year for sure. But there's countless. I mean, I feel like I would do it a disservice just to give it one, but but such great memories. But that was one that really sticks out.
What dorm was that again?
LLC 1. What
was it? I thought Abby won that year.
No.
Okay, I'll give it to you. So let me ask you this. Now, I want to talk a little bit more about what you do on a day in, day out as a plastic surgeon. I am all into health and fitness and eating right and doing a lot of push-ups, but some people need some tune-ups. Can you help with that? Talk about what you do.
Absolutely. So I'm a plastic surgeon, and my practice actually has it's gone through a little bit of an evolution, probably within the last maybe even 1.5 to 2 years. But the foundation of my practice, or what I went into plastic surgery to do, was ultimately to do breast reconstruction. Having seen, worked at Grady Memorial Hospital, worked at Bentob Hospital in Houston, worked at Parkland Hospital in Dallas, which are these huge county hospitals that typically serve brown and black women or brown and black patients, underserved populations. They weren't getting the same quality of care. Well, not quality of care. They weren't getting offered the same, the same methods of reconstruction that, say, you would get if you went to a private hospital. And so I saw that as a real deficiency. And that's really what took me to plastic surgery in the first place, was to do breast reconstruction. Of course, little did I know that breast reconstruction is literally like this much of plastic surgery, because plastic surgery has so much breadth to it. But that's initially what brought me to the DC area, which is where I practice now. And it actually took me to Howard University, because I knew there that I would be able to serve the patient population that I was so passionate about. So probably for the past, I've been at Howard since 2012. I'm an assistant professor there. And my practice started out almost exclusively doing breast reconstruction, but has since grown to not only doing breast reconstruction, I do abdominal wall reconstruction. So people that have had a lot of abdominal wall surgery or trauma or something to that effect. Early on, we did a lot of lower extremity reconstruction as well for people that were in car accidents or any other kind of traumatic injury. And then even then, my practice sort of evolved, because my office, I share an office or a suite with some of the bariatric surgeons or the weight loss surgeons. And so after patients would lose a ton of weight and they'd have all this loose skin, I started to do a lot of body contouring for major weight loss patients. And so that really started to broaden my practice. So I was able to do a little bit of reconstructive, a little bit of cosmetic. And then later on, when I was at Howard, I actually started to get a lot of transgender patients that would approach my office. And so I do a fair amount of transgender top surgery or gender affirmation surgery. So that's sort of my reconstructive life at Howard. And then I guess now it's been about a year and a half ago, I had the opportunity to transition to a private practice in partnership with the dermatologist in Chevy Chase. And that part of my practice is exclusively cosmetic. Initially, I wasn't super attracted to that aspect of plastic surgery, because I kind of thought, it's superficial, nobody really needs it. But the more that I have been, the longer that I've been a plastic surgeon, I was doing cosmetic surgery all along, but just not as frequently. Now, it's probably about a 50-50 mix in my practice. But I find sometimes the cosmetic surgery portion to be the most challenging, because one, the patients are a little bit more demanding, because patients know what they want. They're completely elective procedures. But what I've learned from my patients is that really cosmetic surgery is really what you make it. So the majority of my patients that come in are healthy, fit. They take great care of themselves. They're very secure in who they are, but just kind of what you said, they do the work, they put in the time, they exercise, they eat right, but there's just certain things that don't quite fall into place like they want it to. And so we can do little tweaks just to kind of help them to become a better version of themselves, not to change them in any, to change them and make them a new person, but just help them to become the better version of themselves. And so I find that that's what my passion has become in my private practice, is really being able to take a patient and say, okay, what is it that you just want to improve on? You're already amazing, but what do you want to improve on? And that's been extremely gratifying. It's also been extremely gratifying because my practice in particular, it's called Cultura. It was founded by a dermatologist who basically spent his life's work trying to make sure that lasers for skin of color was safe, effective, and getting the job done. And so he has created a practice that is, his motto was skincare for all cultures. And that's really what our practice is. So we treat a lot of skin of color, which is important, because when you start talking about surgery and incisions and scarring, it's nice to come to somebody that looks like you, that understands what you're going through, that understands how your skin heals, that understands how your skin responds to certain things. And so I think now I'm at a point where I've really kind of found my niche, kind of, I have the patient population that I relate to, and I think they relate to me. And so we have this great feedback, and we're able to accomplish the goals that everybody has set for themselves, because everybody's goals are different. So it's a very individualized approach, but it's been very gratifying this last year and a half to be able to expand my practice to include that patient population as well.
Well, Kelly, I love hearing that you love what you do, and you light up when you talk about changing lives. I mean, because that's really what it is. And I can just imagine how many women walk through the door and say, make me look like Janet Jackson, or, something off the wall, and I know that you're great at what you do. But you also make time to give back to the community and to Spelman as well. So I want to start with what you're doing to give back to Spelman, because it's amazing that you and a group of women have come together to give back. So tell us more about that.
So I was brought into a group of women, a group of Spelmanites. So Andrea was my very, very first roommate at Spelman. Well, actually, Monica was my first roommate at Spelman during summer science, but then Andrea, and then my other roommate at Spelman was Monique McLeod Manley. And so Monique introduced me to another Spelmanite, and I was introduced to the group. It's 25 for 25. And what this is basically, it's a group of women. We've pledged to give Spelman each to donate to Spelman $25,000 over 5 years so that we can help with infrastructure, technology, improvements around campus. And it initially started out with 25 women, but it has become so popular that now there are several other women in the group. So I'm not sure if we're now at the 25 or 40 for 25 or what we're at, but it's really been pretty special. And this has been going on now for about 2 or 3 years. We typically meet before homecoming, get together, kind of do some things to talk about the institution and see what we can do to help improve Spelman and to basically bring Spelman more up to date than they are now, and giving the women better technology to use. There's a lot of infrastructure changes that need to be done at Spelman. As we all know, the institution is very old. And we're continuing to grow. We're continuing to provide women with the most outstanding education, in my opinion. I don't think there's any better place, especially no other better places for a Black female to get educated. And we just need to make sure that we're providing them with the opportunities and the resources and the technology that students at other top tier institutions are also receiving. So it's been an honor to be a part of that group of women.
Beautiful. Now you're giving back to Spelman, but you're also still giving back in the community right here in the DC area. Can you talk to us about some of your volunteer efforts right here?
Sure. So DC is, while it's a small place, it is jam-packed with opportunity and organizations and a lot of nonprofits. I'm a member of the Links. I'm a member of the Arlington chapter of the Links, which we do a lot of work. I know Andrea is as well in her chapter. We do a lot of work in the communities, in the surrounding communities. Ours is focused in the Northern Virginia area, but we do a lot of work there. But I also sit on a nonprofit board that is in DC called For Love of Children. It's an amazing organization. It's probably one of the oldest nonprofits in the District of Columbia. Probably over the last 30 years, it's been segmented into different. But For Love of Children is actually the education. So we do after-school teaching, one-on-one tutoring for children. We do scholarship. We do college prep. We have summer programs. And it's really a great organization. I think probably in addition to serving the kids, the other thing that I really love about the organization is our executive director is a young Black female named Brandolyn Anderson. And when I tell you, she has brought that organization up from nonprofit is always a hard world to work in, but she has grown the organization by leaps and bounds. And I just really enjoy working with her and look forward to what that organization can continue to do in the future. But if you're in the DC area, please look it up. We refer to it as FLOC, F-L-O-C, FLOC, For Love of Children. But we are always accepting volunteers. We always need people for the kids. And the kids, of course, we need more Black and Brown volunteers for sure. So if you're in the DC area or DC adjacent, whatever you want to call it, please let me know. We'd love to have you.
That sounds like an amazing initiative, Kelly. So kudos to you for being passionate about what you do as a doctor, but also being passionate about giving back to your community. And thank you for that, because we need more leadership and mentor right in our backyard. So I'm glad that you're doing that. And I'm just thinking, we have a lot of students watching this, a lot of high school students, a lot of college students and adults watching this, and they're on the fence about whether or not they should attend an HBCU or whether or not they should attend a non-HBCU. What advice would you give some of those students watching?
Andrea, that is it's a great question, and it's something that I think, we really have to make an effort to let especially younger students know. I think of late, there's a lot of things that are going on that really kind of show that, unfortunately, we still do deal with a lot of things that have to do with race, ethnicity, socioeconomic differences, and the like. What an HBCU offers is the opportunity to get, again, top-tier educations, because I will put my Spelman education up against anybody's education. I think the two of you would probably do the same. I know all my Morehouse brothers would do the same. So from an education standpoint, that's a no-brainer. But it's really the experience that you get in addition to the amazing academics, the social connections, the cultural diversity, the opportunities that exist to travel abroad, the mentorship. I mean, we get I don't even think I could name all of the people that came to do guest lectures at Spelman and the opportunities that we had. You're going to be hard pressed to find another type of campus where you're going to get that kind of exposure. So for anybody who's out there on the fence, I really don't think you'll regret it. You still have to do your due diligence and do your research, because, HBCUs aren't monolithic, so they're not all the same. It's just like any college. When you're looking at college, you want to consider what's the best fit for you. So while Spelman is the best fit, was the absolute best fit for me, I think Ashley and Andrea would agree that it was the best fit for them. Maybe Spelman's not the best fit for you, but there are HBCUs that come in all different sizes, shapes, flavors, you name it. I'm in DC right now. Howard is around the corner. And if you need a bigger atmosphere, Howard is the largest HBCU that we have. And it's a university. It's got a huge campus. It's got multiple colleges. But I really just think that you'll never regret that decision. You'll make lifelong friends. The other component, and this is not only just HBCU, but I think this is something I definitely even attribute to Spelman College in particular as a Black female. If you want to learn how to carry yourself in a room, how to be around other people, how to know how to navigate systems and maintain confidence, and essentially learn how to keep yourself from getting bullied, surround yourself with a bunch of Black women in a single institution, and you will learn how to be, your sisterhood will take you far, 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 far. I know sometimes if I'm feeling a little intimidated or insecure in a situation, I literally just think back. And I think, in our case, what would Janetta Cole say? What would Dr. Janetta Cole say? What would she tell me to do? And that switches that switch flips. And then literally I'm calm, I'm collected, I'm confident. And I just don't think I would have gotten that same sense of confidence or that same security at any other institution.
Wow. And I love that confidence. And I love your grace and your poise and your passion for what you do in your practice, what you're doing in the community. And I know there are tons of people watching that are going to want to know where they can find you on social media. So if you can share your social media handles, your websites, and there are plenty of folks that are going to need some tune-ups. And if I need a tune-up, I know where I'm going.
Absolutely. So my practice is Cultura, Cultura. The website is culturamed.com. So culturamed.com. Probably my best social media handle is on Instagram, and it's the Bolden Beautiful, or at the Bolden Beautiful. So TheBolden Beautiful. So feel free to look me up there. I'm happy to speak with anybody. If you have an interest in medicine, if you want to talk about the journey of going through engineering, or if you just want to talk about, being a Black female and trying to navigate, this type of world. I think all of us are great candidates for that. If you've been watching this show weekly, you know that your hosts are probably more phenomenal than I am by far, because these women are super motivated and have created an amazing platform. So please look me up, but keep this show in mind, because this is a great opportunity and great insight for students, for young adults, for adults our age who may be looking to renew or refresh. So thank you guys so much. This has really been great.
Well, thank you, Dr. Kelly Bolden, MD. We are so excited that you took the time to talk to us. Thank you for sharing all of your social media handles and being open to talk to so many people. And we thank you for saying all those great things about HBCU highlights, because we are spotlighting graduates just like you who have that passion, that calm, collective, cool passion about what they do in and out of their career, and you are doing it. And we are so proud of you and proud to call you our Spelman sister. So thank you everyone for tuning in to HBCU Highlights, and we thank you all for being here, and Kelly for joining us today.